All right. Today I'm going to discuss how to publish your first case report. So my presentation is for beginners, and case report is a very easy um, publication type that can be done. Just a second here. All right. So today I'm going to cover quickly and easily how to choose your case for a case report publication, how to take your consent from the patient to publish it, how to form your team, how to write that case report in a hands-on tutorial we'll do together, and how to choose and submit to a journal and a conference, if you may. So first of all, let's go to how to think about an idea, and if you see an interesting patient, how to decide it's suitable for publication or not. So basically, case report has to be either a unique finding in a even like in a common disease, but something that unique or atypical presentation, or could be a rare disease that someone don't see that often, or maybe a common disease, but there was something like a key important lesson about it that you want to send to the medical professional that will read your article. So let's go to PubMed together. Okay. So if you go to PubMed, and let's say I will tell you about a case I saw a few years earlier about Moya syndrome that was induced by Graves' disease. So let's say you write the keywords Moya and Graves' disease. So you have 59 articles. If you go down below, you can filter by using case reports, and then it gives you 39 results. So there is 39 published case reports about Moya and Graves. This doesn't mean that I cannot publish it, but it means that there's a lot about it in the literature. But you have to go through the results to make sure it's similar or different than your case report, because if it is the same, there's no need for publishing it. But if it is different, or there's any different lesson or key finding or unique abnormality in the patient, then you can go ahead with publishing even with that number of results. So you just write the keywords with a capital and in between and filter by case report and see if there is a good number of papers or not, and then you can proceed with publishing it. And of course, you can consult with any expert in publication or research that will help you as well. But that's the easy way to do it. So that's how to search about PubMed easily. The next step will be how to take patient consent. Let's say you did your quick search and this is a good idea for publication. The next step is to take a patient consent. Um, this consent form is from BMJ Case Reports, a journal. And actually, all patient consent forms are kind of similar. It has the name of the patient, description of the case report quickly, and just a title. And then the patient read this information, instruction, explain it to him or her, and then they sign it with the contact details. And not all journals require the actual consent form to be filled, but it requires that you say, it will ask you, did you take patient consent, yes or no? And you can say yes if you did. No, no, it will not be published, of course. But some other journals will ask for the actual form to be uploaded when you're submitting to the journal, and BMJ is one of them. So you can make the patient sign that form or any other form that you find online. It's fine, as long as it has the same instructions. And if you Google BMJ case report consent form, you will find that document. So that will be the next step. So the first step is to see that case, think it might be interesting, search in PubMed, and then do a consent form for the patient. And then the next step will be, yeah, so the next step will be forming your team. and deciding the authorship rules, which is a very important step actually, because I would like to know how you think, how many authors are usually in a case report, if someone can write in the chat section. Um, do you know how much? How many? So usually it's 3 to 5. That's the number. Shouldn't be more than 5. It's a case report. It's not like a original research. And usually the first author is the one who saw the case and is going to do much of the work. Last author is the supervisor or the senior clinician or senior research author, and the corresponding author, the submitting author, is the author he will submit to the journal. So those are the most important three in the article, and then you might have one or two more in the middle who did some of the work, but not enough to be first or last or corresponding. But 3 to 5 is appropriate for case reports in general. Um, and then how to write your case report. If you go to, this is a case report that I've written recently about treating COVID-induced post-immune ANCA-negative presenting glomerulonephritis. So your case report, you have their authors, their affiliations, you have to choose the corresponding author, and then the author's email addresses or their ORCID ID, which is like researcher ID. You can Google that. And then you have summary or abstract of your paper, just like 300 to 500 words, not more than that. Those keywords for indexing the article. And then you have fixed topics, titles, background, case presentation, and then you have figures if you have any, tables, and then you have also discussion. Discussion can be just a few paragraphs, or you can give it some titles if it needs to. And then there is conclusion. And then at the end, there is references. Usually the references are not more than 20. Okay. So this is an example of a case report. And this is a template that I can share with you after this presentation. You have your title page, which you have the title, the number of authors, usually 3 to 5, like we said, with their affiliations, emails, email addresses, and ORCID. Corresponding author, it has to be listed as well. And then only 4 parts: background or introduction, case presentation, discussion, conclusion. This is just the summary. Do it at the end. And it's very important if you're going to submit for a conference, because when you're submitting for a journal, it asks you for the whole manuscript. But if you're submitting for a conference, for a poster or a presentation, it only asks you for a summary of this. So just do it at the end, but it will be abstract will be the form that we submit to conferences, but the whole manuscript will be the form you will submit to journals. And then this is how you should write it, actually. You have your title here, and then everything you write, it has to have a reference. We cannot just write, even if it's something very common knowledge, it has to be with reference. And I will tell you now how to do it. So for background, you write maybe one paragraph of, let's say we're talking about Moya Moya and Graves' disease, for example. So you write about the incidence and prevalence of Moya Moya and Graves. If you find any cases in literature, you should mention we found like similar cases, or we didn't find any cases that's like this case. That's why it's interesting. And then you summarize your case just in 1 to 2 statements, and then 1 to 2 statements why this case is challenging or atypical, and then summarize your key lesson or success in managing this difficult case, or whatever unique or rare about your case. So you will only have to provide reference for the incidence, prevalence, and maybe similar cases if there's any. The rest doesn't need references, just what you found in your case, right? And then, okay. And then the case presentation itself doesn't need any references because this is your case. This is a summary of what you've seen. Just one statement about demographic, like this patient is 45-year-old man or something like that, and then presenting complaint, one statement is presenting with just like one complaint, like hematuria or chest pain or whatever. One statement about positive history, like this patient has a past medical history of ischemic heart disease or something related that's very important. And any negative relevant history sorry, the positive history means like the positive symptoms that he has, like he has shortness of breath or hematuria, any symptoms that he has that's related to the main complaint or the disease. Negative history is the negative symptoms that are not there, that are important to know about this patient. And then past medical history, you write the positive and the negative. Positive means what medical comorbidities we should know about in this particular case that the patient has. Negative means what does the patient doesn't have that help us rule out some other differential. You don't have to mention the whole medication list, just one statement about the important ones, okay? And then allergy, surgery, family history, mention only if they're relevant. Otherwise, say negative or unremarkable, just one statement. And then that's your history part. It's usually in one paragraph with no references at all. And then you go for your physical examination or vital signs. You start with vital signs, just one statement: the temperature was this, and blood pressure, heart rate, saturation, just to give the reader an idea of how the patient did look like. And then you mention the physical exam, just one statement for the positive findings. Let's say this patient had rash or splenomegaly or hepatomegaly or whatever, and negative physical finding that the patient did not have, like he didn't have crackles, he didn't have edema, something that's related to the case. You don't have to mention the whole exam, just one statement, positive findings, negative, one statement of negative findings. So that will be your physical exam. It can be done in one paragraph as well. And then you go for the third paragraph, which is lab investigations. Usually we do it in a table format, the test in one column, and then the lab value of the patient, and then reference value, just because it will differ if you're writing it in the UK or the US. Both have different reference values. So you write all that according to what patient had. And then you can do another table for imaging studies if there is any. So those are the two tables we usually add. And then you can also add some figures about is there any X-ray, CT, MRI, biopsy, histology, anything like that. So usually if two tables, three figures, that's what you need. So you have to, if you included that table, you don't have to mention all the investigations again in your paragraph. Just mention the summary of the positive lab findings, high, normal, low. Okay. Mention your imaging studies again in a table. So that will be your case presentation: history, and then vital signs examination, summary of lab, and radiology or figures if there's any biopsy or histology. And of course, if you have more figures, that will look better for your case report because publishers want to have figures and images. And then last paragraph in your case presentation part is you summarize your clinical thinking and management. So you can say, we found this patient has this differential diagnosis, and then we've treated the patient in this way, and then this happened, and then this happened, just in one paragraph. No literature, don't include any references, just focus on the facts, include figures like we said, ECG as well, one big one. So this case presentation is the core of your case report, and it should reflect what you think as a clinician and how you approach the patient and how you manage. And if I read this, I should know where you're heading towards your discussion later on. And then the next step will be discussion. Usually you have a lot of references here because everything you will say, basically, it depends on literature, on your search in PubMed, for example. But only include relevant information. You don't have to, let's say you're talking about Moya disease and its association with Graves. this is not a review. We're not going to discuss everything related to Moya Moya or Graves. No, we're not doing this. Basically, you will do one statement of definition of the disease and condition. Let's say Graves is this and this and this, and Moya Moya is this and this and this. And then any diagnostic criteria that applies to your patient, if there is any, just one statement. And then one to two statements about the cause of the disease or the condition, what causes Moya Moya, what causes Graves, and how they might be related, and the pathophysiology, if there's any. This all from the literature. You don't have to mention it. I mean, you're not going to make it up. You have to get reference for everything. And then how it's being treated. So basically, you're doing one paragraph about summarizing the Moya Moya and Graves disease from the literature, definition, diagnostic criteria, etiology, pathophysiology, treatment, and then one paragraph of discussing what is related to your case from the literature that make it interesting. A typical diagnosis, or it's rare, or some imaging finding you found, or a key lesson that you would like to convey to your readers. It has to be from literature, saying, "Oh, when I looked for the literature, I didn't find any Moya Moya and Graves disease happening in pediatric patients, and my case is a pediatric patient, for example." Or this one usually it's treated by this treatment by tried that treatment and it worked or didn't work or something, right? So that's another paragraph, and then one paragraph summarizing the case again that you discussed before, just one paragraph, and linking the literature to it and why it's interesting. And then maybe if you found similar cases, you can write one to two paragraphs about that and just compare and contrast. Like, oh, we found similar cases that this and this, we did the same and it didn't work or worked, or this is different from our case, this is similar to our case. Just three, four lines, not more than this. So this is your discussion template. And then your conclusion is summary of the paper in just one paragraph, why it's important, the key lesson, no references here. So as you've seen, um, the background, just one big paragraph, a little bit of references, case presentation, three or four paragraphs, no references at all, discussion, three, four paragraphs, some references, conclusion, one paragraph, no references, and then you write your keywords. So that's what it usually is. And then you should put your references according to journal style, usually 20 references, not more than this. Some journals will not accept your paper if it has more than 20 references or more than five authors. Those are your limits, kind of. So that is how we format our case report. But I just wanted to show you as well how to write and do references in the same time. So if we go to here, so let's say I went to Google now and I would like to know the pathophysiology of Moya Moya disease because I want to write it and document it. So I can write Moya Moya pathophysiology, let's say, and just write PubMed next to it. Okay. And then it tells you here there's an article that's progressive stenosis of the large intercranial arteries, something, right? So you go to that paper and you can read it, read even the abstract. If you find what you're looking for about the pathophysiology and the causes, then summarize it and paraphrase it in your own words after you understand it. You cannot just copy and paste, that's plagiarism. And you can read, understand, paraphrase in your own point, and then click cite, take that reference, and then put it in your Word template. Just a second here. So you put that reference here, and then let's say I'm talking about pathophysiology of Moya Moya, and then say it includes something, 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 and then write one because this is my first reference, and then I have the reference here already. And then let's say I would like to talk about the causes. Just one statement. I go to PubMed, search for causes, and summarize it in my own way as well. And it will be number two, and then put it again, two, and then put the reference. This is how it looks like. I'm not gonna do it all, of course, because of the time, but it shouldn't be more than that. And 20 reference, you're done. So case report, honestly, if you have like a free weekend, you can finish in one day. If two, three, four, five are working together, maybe a week you can finish it. It's not difficult to do. Um, so that will be how to write it. The next step will be choosing the journal. So now I've written it. I would like to send to which journal? I don't know. There's a very good website here called Journal Guide. If you go here. So let's say this is my article. I'm just saying, copy it. Just copy the abstract, okay? And then you go to Journal Guide, that's a website. In your manuscript title, just write the keywords like Moya, and Graves. And then in the abstract, uh, just copy paste your abstract that you've done, the summary of your case report, or even the whole case report, and then click search. So it gives you like 18 journals could accept your article. And here it gives you the name of the journal, Journal of Neurosurgery, for example. Impact factor is 1.8. So the higher the impact factor, the more popular or more citation the journal has. I think tells you it's open access or not. Just to let you know, any open access journal will ask you to pay a fee to publish it. Not open access journal, or I mean closed access journals, will not ask you to pay. That's another factor, because let's say I want to go to Journal of Neurosurgery, or World Neurosurgery Journal, to write that and write article processing charges, because that's one of the factors that you will choose about. It's $1,700, right? So if you're some institutions you work in can give you fund for it. Some other institutions have agreement with journals to waive the fees. Some other institutions, especially from developing countries or middle income countries, can waive the fees as well if the corresponding author is from that particular country. So sometimes if you, let's say, I'm working in the UK and collaborating with someone in the US and collaborating with someone in the Middle East, like Egypt, and my friend in Egypt would like to be the corresponding author, this can waive the fees of the article. Okay, and this all be written on the journal. So you have to read a little bit about article publishing charges and when they waive it and everything. It's written in detail. There's a funding arrangement, and you can click here, tells you more details and stuff like this. But you have to decide as a team which way you're going to go, which journal, and then you start submitting that to the journal. The next step will be, so after you choose a journal, make sure you search for that journal in Pills list. Pills list is a list of fake or predatory journals that have no value and just steal your money for publishing somewhere. I mean, it's a list of bad journals, basically. So whenever you find a journal, just make sure it's not in that list. If you find it's in that list, then don't go through there. Okay. Let's say now I chose the journal I would like to submit to the journal. I'm ready. I have my manuscript. I have my author's details. We decided to submit to a particular journal. So I will just give you a tutorial how to submit to Curious Journal, one of the journals I reviewed for. If you go to, sorry, if you go to here, sorry. So this Curious Journal, you sign up, you make an account, and then you click Submit Research, for example. And then get started. Is this a competition? No, it's not a competition. Sometimes they announce competitions. Is a channel not a channel? No, not a channel, sorry. And then article type, you choose a case report, save, and then it asks you for some other stuff here. It asks you for a title, abstract, categories of the paper, keywords. You're ready for all of that because you've written already. Authors, disclosures, the article itself, then we'll list the references, and then you submit. That's it, basically. I cannot just proceed because we have to put something here. And every step on the way gives you what style do you want the title to be, show you an example and stuff like that. So it's very self-explanatory, very easy to do. Just follow, and all journals are the same. It doesn't have to be curious, anything else. So that's how you submit your uh, uh, article. And the other thing is not all journals accept the same number of words or the same number of references or authors or even structures. So in order to be sure, you have to search for authors guidelines of your particular journal. So if you go to Google, for example, and write Curious Journal Authors Guidelines, it give you that. PMJ Journal Authors Guidelines, it give you that as well. Um, so I will show you some of it. So if you look here, this is the author's guideline for Curious. It tells you that the title has to be in APA style, only one sentence. The abstract has to be 3,500 characters. And then you have to choose 1 to 3 categories, 5 to 10 keywords. And the authors should be, there's some rules about the author you have to read. They don't accept more than 5. Some disclosures if you have any conflict of interest. And then the text formatting is really important. No bullets, no indentations, one line, space after each paragraph. Some other criteria you have to follow. And then conclusion should be only 1 to 2 paragraphs. Uh, Media shouldn't have more than 25 images. That's what they ask for. References should be formatted in a specific way. And then tells you everything you need to know about how to uh, um, format your article. If you go for BMJ, for example, this is for author's guideline. Uh, if you check BMJ case report, author guide, it gives you a guide here that it has a lot of information you should follow. Um, Checklist, you should have the consent. They're really important for PMJ. Uh, Gives you some even writing instructions here and how to present your information. And tells you everything about the process. But if you go here, it tells you how to submit. You see, the case report should be in Word document. Each figure should be in each Word document. That's how they want it, and they want a patient consent form and some author statement that you all agree on the publication. And then it tells you what kind of patient they want. They don't want more than 2,000 words total. So each journal has its own different criteria. So after you cannot just make that up in the beginning. You have to finish it all, and then you start submitting for BMJ. If it's accepted, it's accepted. If it's not, then you go for another journal and then submit it according to a different guidelines. So you have to change it till you get accepted somewhere, and that tells you how many authors and everything, as you can see. So it's really important to follow that in detail. Um, so submission to a journal, we covered that. And then one other thing is we as a team, under Dr. Hisham's supervision, we submitted four case reports to conferences, and they were accepted. One in Dubai, and the other was in Barcelona in the European Society of Emergency Medicine, and two of them were accepted in CHEST. So basically, you can submit your case report to a conference, and after you go and present in that conference, you can submit it for a journal publication as well, and then you can get two publications out of it: the poster presentation or the oral presentation that you've done in a conference, and the journal publication as well. So each case report you can get two outcomes out of it. So an example I will cover right now is the American Society of Nephrology conference, which is called Kidney Week, just to show you how it's being submitted. So in each specialty, if you know what are the big conferences in the US and Europe, in the UK, international. For each specialty, there's three, four big ones that you would like to submit to. So if you go write that name of the conference with the word abstract presentation deadline or submission deadline, it will give you the exact dates that you have to submit at. So if you go to here, so this is the Kidney Week or the American Society of Nephrology. It tells you that the case report deadline was opens April 12th, and then closes May 24th, and you will be notified by August 11th. And there's a submission fee for American Society of Nephrology. But other conferences don't have any submission fees. Actually, most of them don't have any submission fees. And it's very easy to be accepted in conferences regarding compared to publications, of course. So that will be, you have to know the exact dates for each of your favorite specialty conferences around the year, just to make sure you have something ready. And they open it maybe a month or two before that date of presentation. So you'll know in advance. So let's say I would like to submit something here. You create new submission, and each conference has its own portal. And it just asks you for uh, yeah, they want 2,500 characters, not words. That's around 300 words, just half a page. That's it basically. So you submit that abstract, and once you get accepted, you design the actual poster itself later on. So you write the title, you write the description, you write if you have any table or any images, you upload them, and then actually that's it. So in your description, you write here uh, uh, the discussion, the case presentation, and conclusion. It doesn't need a lot, just 300 words. So my recommendation is whenever you have a good case, submit it to the conference of your choice in your specialty, and then present there. And then after it's presented, start submitting into a journal. And then you can get two publications out of that particular case. Um, and then you fill all that, fill the authors, then submit, and that's it. Just wait for acceptance. And 90% of case reports are sent to conferences or get accepted. Actually, it's not a big deal. So that's how it looks like. So that was my presentation. Actually,